it's Rafael Gutierrez, and I started with the Makiwara. I usually do about 100 of those, then switch to the other leg, so I get 100 each time. And that's actually training as adults we will do in karate, so we can actually get the feel for how we should punch, and we can see the alignment. We can see. I actually stop at that because and only do it once a day because if not, my hands start changing, the skin starts changing, and my girlfriend doesn't like it. So. Figure I have to make her happy too. The thing I wanted to talk about is based on a question I saw on YouTube, and that had to do with the little boy who was doing really some amazing things. And someone had actually shown up what this child's practice regimens are. And the question was, is it right to have students, actually kids, train that hard? And I did know the basics, but I did go back and research, make sure that the basics were what I remembered. There are now a lot more of sports for children, and every year it seems that the competitive rate, what they call elite type athletes, the age goes down. So people are training kids harder and faster at a younger age than we ever did before. A lot of times, I remember one kid tell me that he hated soccer, but they put him in. He used to love soccer. He hated it now because that's all he was able to do. His parents found that he was good at it and just pushed and pushed him. And there is a psychological breakdown that actually happens. If you think about it, if you're an adult and you make your hobby into your job, you start hating your hobby because it's no longer a hobby. It's now something you have to get up and do every day, whether you feel like doing it or not. I actually want to talk more about the injury. And what we find is about 50% of the injuries that we're seeing for musculoskeletal injuries are repetitive trauma or overuse, meaning these are movements that people are doing over and over again, which ends up causing a lot of problems. Now, actually, one of the sad parts about it is in pediatric sports medicine clinics, they're finding about 50% of the children who go there are now suffering from chronic injuries, meaning that these are injuries that don't go away. Now, these actually resulted from the microtraumas or the overuse, and they're getting them at a younger age, which means that a lot of times these kids who are pretty much being put as, look how great, he's an elite athlete at 6, their bodies are shot by the time, their bodies are actually starting to get injuries that we shouldn't be seeing in adults, which means by the time they're 30, they're not going to be able to do their activity. Without realizing it, we know that there's a point where if we start having pain, we have to stop. Kids don't have that. And I used one kid I had in my class when he first started. He ended up coming with me with a broken hand, which he broke playing sports in elementary school. Came into karate the next day, and I asked him to make a fist. Instead of telling me that his hand hurt, he made a fist and started crying. I later found out that he had fallen. I don't know what he was playing, but he had fallen somehow, broke his hand, and had gone the entire day without complaining because, well, no pain, no gain. You actually see this in dancers, by the way. A lot of little girls will be put on ballet and their feet will hurt for an entire week. And they won't say anything because, well, it's just part of you have to get used to it. And that's a mentality that we really have to get out of people who are teaching kids and parents. You have to remember, just because you wanted to be a professional athlete doesn't mean you understand how to make a child a professional athlete. Now, there are actually some stuff that we find. Mostly is these overuse injuries are usually resulting from the microtraumas, and they're usually about less about the force as much as the force being used over and over again. Interesting thing that we find is those students who don't specialize in a sport, which will do different things, they actually have less incidents of burnout and fewer injuries. The reason is probably if you think of something like baseball and pitching. If you're constantly pitching and you're doing this for 365 days a year, you're going to cause more damage than if you do it for a season, then you switch over to soccer and you work another, and then you switch over to another. And so apparently if you have an athletes who are really interested in sports, it's better to have them in multiple different sports than one. Problem with this also comes with something that anyone who teaches martial arts has seen with some kids. Some kids are in so many different sports that they're exhausted. And by the way, this exhaustion will cause fracture. Everything can fail is the best way to put it. And the body structurally can actually fail, and it's worse when these failures happen in young children. One of the big things is overtraining is a problem. And like I said, especially if if the instructor is not knowledgeable of the changes that happen in kids throughout their ages. Children can be exposed to excess injury, and this will cause a lot of exercise, and this will cause a lot of injury. Now, what are the long-term effects? Well, one of the things is they're actually with the child as they are growing. Some of these problems that they can develop usually damage the cartilage, the area between the joints. But in kids, it's also the area where the bones are still growing. And if you damage cartilage on one side and not in the other, you can end up having limbs of different sizes. So you may have someone who's a great runner, they actually damage their epiphyseal plate, and now one of their legs will be longer than the other. Their ability to run as they were is no longer as effective. Another thing that can happen is something called Osgood-Schlatter syndrome, where what happens is you have a little bump on the tibia, which is a lower bone on your in your lower leg, right as where the kneecap comes in. And what can happen is kids can pull that off, and it causes severe pain and separation, and you would then end up having to modify the way you would want to do the exercises. So it is one thing to actually look at. Your overtraining or training kids too early can cause problems, especially if it doesn't work with natural movements. Now, there are certain things that kids can actually do better than adults. For instance, they are more flexible. But we can use the flexibility to train them, always reminding them that if something hurts, they have to pull back. There's a lot of injuries that can happen from overtraining, overstretching, and as instructors, especially if you're an instructor or a parent, it's your responsibility to make sure that these things don't happen. Now, there was a study that took 60 million children ages from 6 to 18 and looked at their related injuries in sports. And what they found is some really interesting things. It's found that most of the injuries were actually due to overuse. Understanding how bones differ from adults and children, and actually understanding how bones themselves at work will actually help prevent a lot of these problems. But the repetitive and constant training will end up being detrimental to kids. Injuries in children usually were related to an immature skeletal system, and you actually did see a lot of different things when you ended up getting to the 18-year-olds. Now, we followed 153 adolescents who had injuries, and of them, 65% of them still had knee pain 2 years after the injury occurred. So think about it. In adolescents, 2 years after developing knee pain, still had them after 2 years. So that's one of the big things. And some of them actually had it, like I said, most of them had it daily. The important is that when we're looking at kids, we're looking at adolescents, we got to remember that they're going to push themselves probably harder than any adult. And if they do, they can actually do damage to their cartilage, which will end up leading to lifelong problems. This is especially true when they're actually growing. You can get micro tears, inflammatory scars. You can even get bone formation in areas that you shouldn't have bone. And that ends up causing a lot of problems. The other thing that you can have is you can end up having different types of calcification in kids, which will actually end up increasing problems. For instance, you can end up having deformities due to avascular necrosis. I did a thing on the hip, and what we find is if you're continuously doing roundhouse kicks, and you know I always wear a hat, if you're continuously doing roundhouse kicks, you have an increased risk of getting avascular necrosis of the hip because of just the structure. I haven't done any follow-up methods, but the structure seems to suggest that. Now, problems that can present are everywhere. I mentioned about getting the avascular necrosis, but your femoral head and acetabulum can end up becoming impinged. Now, once that happens, usually there's actually three versions. The main one that happens in young athletes is called a cam deformity, and it's because it looks like a camshaft deformity. And one of the things that people actually forget is that once you have something like this, the treatment will eventually require surgery. Now, think about it. If you're pushing a child too hard, too quick, doing moves that their body isn't made to do yet, you can end up having kids with deformities that will require surgery. Now, the question I would ask you is, if you have kids, is it worth giving your child a lifelong deformity so he can do a high kick? They're finding that pediatric sport injuries lead to a lot of osteoarthritis at a young age. And these actually cost not just the parents and an insurance company, but society a lot of money. You now have a child who, in essence, is becoming physically disabled. These sports injuries, particular knee and ankle, and osteoarthritis, are really likely. Early osteoarthritis has an intense uh, effect on how they're going to participate. And one of the things that they found is when these kids do get these knee pains, ankle pains, and osteoarthritis, they are more likely to give up their physical activity than if they would have had these things later on in life. At the end, I guess what I want to say is when we look at kids, we have to realize that their bone structure is not fully complete. They still have certain aspects of bone growth that are important to maintain healthy, active life. And if we overtrain a child, their joints will wear, their knees will wear. You can have avascular necrosis of various bones and joints, and this will end up leading to lack of function. Now, think about how bad this is. One of the bones that you can end up having avascular necrosis on, and is a navicular bone of the foot. Now, it's a little square-shaped bone, which, if you do have avascular necrosis there, it throws off your entire foot. The thing is, you have to remember that the foot's continuously growing, so you're going to have problems with that too. I guess the take-home message is we have martial artists and athletes who are children, and if we forget that they are not adults, their bone density is not where it should be, they're still growing, and we push them too hard, we can end up having a lot of problems, and we may end up pushing the child out of the activity they enjoy. So with that, I'll sign off, and thank you for watching.